This is UNOS. You are being notified that you have a liver organ offer from UTOP.
Tim O'Rourke doesn't know it yet, but he's about to receive a new liver, the organ that will save his life that he's waited for years.
It was originally diagnosed in 1992 that I had hepatitis C. It's courtesy of Vietnam War experience in the Navy in the 70s. And the disease slowly progressed over a course of 30 years, really.
His long ordeal is about to end, but first, there's work to do. Today, the team from Intermountain Liver Transplant Program is hard at work frantically preparing for surgery. It's the big event that dozens of people have spent months planning for. And it's a routine the team knows well. The program is the largest, most experienced liver transplant center in Utah and one of the most successful in the country. The team has performed nearly 750 transplants in its 25 years of service, including the state's very first liver transplant and the first living donor liver transplant. All that experience shows. Intermountain Liver Transplant Program patients spend less time on the waiting list and have better survival rates on average than patients nationwide. For Tim, and for all the patients who receive a liver in the Intermountain program, the long path towards survival begins the same way, with paperwork, phone calls, lots of tests, and conversations. Each transplant patient meets with a social worker, an insurance expert, a nutrition expert, and a surgeon who all explain what to expect. There are sophisticated scans, blood work, and routine tests to ensure each patient is both healthy enough and sick enough to qualify for a liver transplant. Once a week, members of the transplant team come together to review each patient's case, who's gotten sicker, who's doing better, who needs a liver to survive, and each week that list changes. This week, Tim O'Rourke lands in the right spot at the right time.
We have a liver, Timothy O'Rourke. That is, I got just a phone call from one of the IDS, Intermountain Donor Services coordinators, and they just said, you know, we have a potential donor, and they're in at University of Utah, and they just give me a few basic information. At that point, then I talked to the docs, and then that kind of just starts this whole process, and it actually kind of went all night trying to just get everything arranged in timing.
But there's a complication. The team's transplant surgeons are already in the operating room working to transplant a liver in a different patient and kidneys in two others.
Well, we've been taking turns sleeping, and so we're well rested and still energetic and ready to go. So we're just getting started with our last transplant for this afternoon, and then we'll wait to see when the next procurement's going to go.
Christy, the coordinator on call today, can't wait. She needs Tim to be in the hospital ready to go within a couple of hours in case the team decides to proceed. So, at 11:30 in the morning, she makes the call.
When I actually got the call today,
You lose everything in your
all
mind.
control went out the window. So here we are, and this is the day, and I'm 55 years old, and I'm given a second chance, and hope everything works out the way I'd like it to.
Every patient who receives a new liver is extremely ill, but Tim's case is complicated by a secondary disease, pulmonary hypertension.
Patients who have liver failure get screened frequently when they're on the liver transplant list looking for pulmonary hypertension. And when they find it, they actually have to take them off the active list because the surgery is too risky. They could lose the patient, and they could also lose the liver if that person were not to do well with the surgery. And so once they have this disease, we take them on and try to get their pulmonary hypertension under control. And in Mr. O'Rourke's case, it actually worked really well. So his numbers came back down to normal, and so now he's a candidate for liver transplant. So we have to figure out how to keep our medication going during the surgery, and when do we start trying to wean it off to see if he's okay and everything's gotten better, because he could potentially be, the pulmonary hypertension could be cured with the liver transplant, so we're excited for him.
Tim needs a special device implanted before surgery can begin to ensure his heart will make it through the 7-hour operation.
I feel like I'm in great hands here. The nurses have been exceptional. So think I can ask for more than that. That's just me. I have to do my part and be strong, and hopefully my body will accept everything it's supposed to and be a good day.
Some transplant patients get this far, but don't actually make it to the OR.
That's probably one of the worst parts of my job, is actually having to go in and tell a patient that for one reason or another the organ donor is no longer suitable, and that we've turned down the organ and sending them home empty-handed.
Today, the O'Rourkes are in luck. Despite being in the operating room for nearly 20 hours already, transplant surgeons Dr. Willem van der Werf and Dr. Shiro Fujita have been able to get some sleep. The donor's liver looks good, and Tim O'Rourke is healthy enough to proceed. Doctors van der Werf and Fujita begin their second long day of work, and their fifth transplant in just 2 days. With a specialist standing by to keep an eye on Tim's pulmonary hypertension, they begin the surgery that will change the O'Rourke's lives.
We have a huge team of people, including several surgeons, several anesthesiologists, nurses, critical care personnel. Then we have the laboratory personnel who will be supporting us throughout the case, providing lab results, and probably there's going to be 50 to 100 people who are involved in his care today.
Close to 150 different people have played some part in making sure Mr. O'Rourke goes home healthier than when he arrived. Office staff, surgeons, lab technicians, pathologists, nurses, dietitians, imaging technicians, and more. It's a monumental effort.
The best thing is seeing these folks get well, 5 to 6, 7 days after surgery, and they're so thankful for what they've got.
I'm kind of stunned now. I'm going to actually might live to be an old age and actually see grandchildren and things. I haven't thought of that for quite a few years as a possibility, so it was as good an experience as you could want for something so traumatic. Of course, the most important person is the donor. Without him or her, we're all, out of luck on that. But so it's quite a miraculous event.